Hi, my name is Nursing. Whether you're watching this from my channel or listening to my podcast, The Power of Care, this is the place for nurses to take ownership of their careers. I'm here to share with you the tips, inside stories that will help you grow and thrive as a nurse. I'm a registered nurse with over 10 years of experience in various settings, and I've created this channel to empower nurses to explore the diversity of job opportunities. And in this series, I'll share the different fields, sectors that nurses can work on, such as education, research, admin roles, entrepreneurship, and more. I'll also share my own journey and lessons learned along the way. Whether you're a new graduate, a seasoned nurse, or someone who is considering a career change, this channel podcast is for you. I hope you will join me in this journey of discovering how to empower your career. Today, we are diving into telehealth nursing, a field that is rapidly expanding and evolving, particularly in the US, UK, and Australia. So what is this thing about telehealth nursing? This specialty is a fusion of nursing practices with telecommunications technology. Telehealth nurses provide healthcare services and information digitally, enable patients to receive care no matter what they are. And what about your roles and responsibilities as a telehealth nurse? The roles and responsibilities of telehealth nurses share a lot in common ground. They assess and triage patients remotely, provide health education, guide patients through their healthcare journey, and assist with chronic disease management. The technology used varies from phone calls and video conferencing to advanced digital monitoring systems. So if you're looking to move to telehealth, what type of education and qualifications do you need? To become a telehealth nurse, you must first be a registered nurse, which requires a bachelor's degree in nursing, and depending on the country that you are, you might require further experience, especially in clinical care, and also some extra certifications. So check your country and check the job specifications for more advanced information. Let me tell you from my experience that if you are a telehealth nursing, I would make sure that I have enough extensive experience in the clinical setting, for example, in areas such as A&E or intensive care, to make sure that I can understand and assess patients well through phone, because you might come across very complex situations. So what types of essential skills you might need? As a telehealth nurse, you must possess excellent communication skills, as much of your patient interaction will be through technology. Critical thinking and decision-making abilities are also crucial, as you'll need to accurately assess patients' condition remotely. Of course, you'll also need to be techie savvy to operate the various digital platforms used in telehealth nursing. So how much does telehealth nurse make? In the US, the average salary ranges from $70,000 to $90,000 annually, and in the UK is roughly $30,000 to $45,000. Australia, you're looking at $65,000 to $85,000. However, the more experience, specialization in certain geographical locations, these figures significantly increase. But I would say to you, just negotiate. But what about job opportunities in telehealth? Well, the job market for telehealth nurses is booming, especially given the recent global health events. Hospitals, telemedicine providers, home care agencies, and insurance companies are all seeking telehealth nursing professionals. This trend is evident in the USA, UK, and Australia alike, making it a promising career choice. You might be wondering, what are the advantages of telehealth nursing? One of the major benefits is the flexibility it offers. Since you're not bound to a specific location, you might have the freedom to work from almost anywhere in the world, and this can significantly improve your work-life balance. Additionally, telehealth nursing allows you to reach patients who might otherwise have limited access to healthcare, such as those in rural or underserved areas. This can be incredibly rewarding and can make a real difference in people's lives. As a telehealth nurse, you'll be at the forefront of technological advancements in healthcare, which can be both challenging and exciting. Plus, this experience can enhance your resume, opening doors to more opportunities down the line. But of course, like any career, telehealth nursing has its challenges. The lack of physical interaction can be a drawback for some nurses. Building a rapport and providing comfort to patients can be more challenging through a screen. I also mentioned the lack of networking opportunities. Networking is key for progressing in your career, so be aware that working from home might undermine your opportunities to connect with other people. Another potential issue is dealing with technical difficulties. Reliable internet connections and functional equipment are crucial for telehealth services, and disruptions can lead to delays or rescheduling. Lastly, while telehealth nursing allows flexibility, it can also blur the lines between work and personal life. You must be able to set boundaries to ensure you have time to recharge and avoid burnout. So what's the future of telehealth nursing? Telehealth is rapidly growing in a field that offers many benefits for nurses and patients, especially in the context of COVID-19 pandemic. Telehealth allows nurses to monitor and care for patients remotely using various technologies such as video calls, mobile apps, and wearable devices. Telehealth can improve access to care, reduce costs, enhance patient satisfaction, and prevent unnecessary exposure to infections. According to a 2022 McKinsey survey, between 20 and 38% of nurses responded in the US indicated the likelihood of leaving their current role in direct patient care within a year, highlighting the need for more flexible and sustainable models of care, for example, such as telehealth. The UK has also seen a surge in telehealth adoption during the pandemic, with many NHS trusts implementing virtual wards and clinics to measure patients with COVID-19 and other conditions. Telehealth has been used to support patients with chronic diseases, for example, such as diabetes, heart failure, respiratory diseases such as COPD, as well as mental health issues. A recent study by the King's College London found that telehealth improved self-management, quality of life, and clinical outcomes for patients with heart failure while reducing hospital admissions and costs. Australia has also a long history of using telehealth to provide care to rural and remote populations where access to healthcare services is limited. The Australian government has expanded funding for telehealth during the pandemic, covering more than 30 million services between March 2020 and March 2021. As you can see, telehealth is transforming the way nurses deliver care across the different settings and populations. Telehealth offers many opportunities for nurses to enhance their skills, expand their roles, and improve patients' outcomes. This growth isn't just promising for job security, it also means that there will be continuously improvement and advancements in the sector. As telehealth becomes more integrated into the mainstream healthcare, we're likely to see more support, better technology, and improved methodologies. So, are you considering a telehealth nursing? If you're considering a career in telehealth nursing, it's essential to weigh the pros and the cons. Ask yourself if you're comfortable with the technology involved and if you're okay with the reduced physical interaction. Consider your ability to work independently, assess patients, and have the clinical skills, and also the ability to make decisions without that immediate support from colleagues. Telehealth nursing can be incredibly rewarding, but like any career, it's not for everyone. And that wraps up our deep dive into telehealth nursing. As you've seen, it's an exciting and rapidly evolving field with plenty of opportunities, particularly in the USA, the UK and Australia, and many other places to come. So whether you're just starting out your nursing career or looking for a change, telehealth nursing is definitely worth considering. Not convinced? Looking for a better career progression, pay, and more interactive work with other opportunities to work around the world? Have a look at our videos on jobs on pharmaceutical and medical devices. Still want to stay in patient care? Why not consider working in private healthcare? Thanks for watching and keep learning.